my name is Carson. I'm going to be the student nurse today. I'm going to help with some of your medication administration. So I'm going to pull the curtain for us, give us a little bit of privacy. I'm going to go and wash my hands. So I'm going now scanning your wrist. Can you tell me your name and your age?
Mary Lamb, 89.
Thank you. Okay, so I'm going to look at your MAR records. It looks like we're going to be giving 5 medications today, 2 by mouth, eye drops in both eyes, and 2 injections. Okay, so it looks like your allergies are Registrol and sulfa drugs. Does that sound right?
Yes.
Do you have any other allergies?
No.
Okay, so we're going to start with your first medication, Lipitor. So Lipitor, this is 20 milligrams. You are prescribed 10 milligrams. These are scored, so I would cut these in half. So Lipitor is an anti-lipidemic. It's going to help lower your cholesterol levels. Do you take this at home?
Yes.
Okay. So Lipitor, 10 milligrams by mouth daily. It is not expired and you are not allergic. So this is 20 milligrams, so I would cut this in half. So Lipitor, 10 milligrams by mouth daily. It is not expired and you are not allergic.
Right.
Okay, so I would cut this in half, but I do not have a pill cutter. But I would cut this in half and administer only half of this drug because that would be prescribed. This is 20 milligrams and she is prescribed 10 milligrams. So again, Lipitor, 10 milligrams by mouth daily. You are not allergic and it is not expired. So I would scan this into the computer. It is 8:38. This is within the 30-minute range. It is due at 9 o'clock. So the next medication that we would give is digoxin. This is a heart medication. It inhibits your sodium-potassium pump. So before I would ever administer this medication, I would have to check the apical pulse. So I would get my stethoscope and I would listen to the apical pulse for a full minute. It has to be above 60 beats per minute. Hers is 62, so this is in a safe range for me to administer this medication. So she's prescribed 0.125 milligrams. This medication is 0.125 milligrams. She would get 1 tablet. So digoxin, 0.125 milligrams by mouth daily. It is not expired and she is not allergic. So again, digoxin, 0.125 milligrams daily by mouth. It is not expired and she is not allergic. So I would not have to cut this drug because 1 tablet would be the perfect dose. There we go. So again, digoxin, 0.125 milligrams by mouth daily. It is not expired and she is not allergic. Okay, so then I would administer these drugs. This drug would be given at 8:39 and it is again within the 30-minute range of 9 o'clock. So I would give her these drugs, give her some water if she wouldn't like it. Okay. So now we are going to move on to eye drops. And before I do anything with eye drops, I'm going to put on my gloves. So the eye drops that she is prescribed are the beta-toxyl off drops. It is prescribed 1 drop both eyes daily. Do you take this at home?
Yes.
Okay, this is for glaucoma, so it's going to reduce aqueous humor. This is beta-toxyl. It is given both eyes, 1 drop daily. It is not expired and she is not allergic. So again, beta-toxyl, ophthalmic drops, 1 drop both eyes daily. It is not expired and she is not allergic. So one more time, beta-toxyl, 1 drop both eyes daily. It is not expired and she is not allergic. It is 8:40. This is within the 30 minutes and I will administer this now. So I would open the cap, ask her to tilt her head just back a little bit, open it, administer 1 drop, massage the eye a little bit, other eye, 1 drop, massage the eye a little bit. Does that feel okay?
Mm-hmm.
Okay. So the next 2 medications are injections. So we are going to be giving insulin. So insulin is an anti-diabetic drug. Do you take that at home?
Yes.
Okay. Before we would ever give insulin, we would have to check our fasting glucose. So can I have your finger? I would prick her and test her glucose. The glucose is 250, so I would be administering 6 units of insulin. So I'm going to grab my insulin syringe. And the insulin that she is prescribed is Novolin R, 100 units per milliliter. She is at a fasting glucose of 250, so she would get 6 units. It is subcutaneous. When you give a subcutaneous injection, it is between 45 and 90 degrees. And I'm going to be giving it on her arm, on her upper arm. So again, this is insulin. She is at a fasting glucose of 250. I would be administering 6 units. It is not expired and she is not allergic. So again, I'm going to now take up 6 units. So I'm going to show a second nurse so they can see this. Okay. So I'm going to use a scoop technique to put the insulin on the cap on the needle. So again, insulin subcutaneous, 6 units for a 250 fasting glucose. It is not expired and she's not allergic. I'm going to be giving this in here in her arm. So last check, insulin subcutaneous. It is subcutaneous, uses a 25. This is an insulin syringe. After I would be done using this, I'm going to throw it away. So it is not expired. She is not allergic. We're giving 6 units because of her 250 fasting glucose. Okay, so this would be at a 45 to 90 degree angle. Push that in, take it out. And then to recap this, I would use a scooping mechanism to put the cap back on, and I would throw this away in my sharps container. The last injection that I'm going to be giving, the last drug, I would scan this in to the medical records and say that I gave it at 8:41. Okay, so the last medication I would be administering is a flu vaccine. It is a 1-dose intramuscular. Intramuscular uses a 27 gauge needle. So I have a 27 gauge needle here. And it is a 0.5 milliliter dose. So I'm going to get my influenza virus vaccine. It is not expired, she is not allergic. I would be giving this intramuscular, which is a 5 to 15 angle injection. So again, the influenza vaccine, this is to prevent the flu or prevent a strand of flu. It is going to be given intramuscular. You are not allergic and it is not expired. So now I'm going to draw up my medication. So this is a 0.5 milliliters, so I would get 0.5 milliliters. Okay, scoop it. Okay, 0.5 milliliters. Now this is the influenza vaccine, 0.5 milliliters, intramuscularly. It's 1 dose only. I'm going to be administering this at 8:50. It will be intramuscular, which is a 5 to 15 angle. So now I'm going to decap this. I would have cleared off her skin with an alcohol swab before I would have administered the insulin or the vaccine. So now I'm going at a 5 to 15 degree angle intramuscularly, and I'm going to administer my medication. Okay, so again, I would use the scooping mechanism technique to recap this, and I would throw it in the sharps container. Okay, so I would have scanned in that I would have given that medication. Do you have any questions about any medication that I've given to you today?
No.
Okay, so I would put the rest of her remaining medications back in her drawer or her locked cabinet, and I would throw away both of my sharps containers, And then I would document how she took the medication, if all the medication was given, if there was any refusals, and if she does not have any questions left.
No.
Okay. I will